Good day. Today we will be talking about the different Millennium Development Goals. The United Nations Millennium Development Goals were 8 goals that all 189 United Nations member states have agreed to try to achieve by the year 2015. The United Nations Millennium Declaration, signed in September 2000, committed world leaders to combat poverty, hunger, disease, illiteracy, environmental degradation, and discrimination against women. The Millennium Development Goals were derived from this declaration and had specific targets and indicators. The Millennium Development Goals have been superseded by the Sustainable Development Goals, a set of 17 integrated and indivisible goals that build on the achievements of the Millennium Development Goals but are broader, deeper, and far more ambitious in scope. First is to eradicate extreme poverty and hunger. Developing countries, particularly in Africa and Asia, suffer from extreme poverty and hunger. Poverty and hunger lead to severe malnutrition, which leads to lifelong physical and cognitive damage and affects health, well-being, and the economy. Some key suggestions to eradicate poverty and hunger are education, promoting gender equality, producing more jobs, investing more in agriculture, strengthen nutrition programs for children and infants, support and protection of developing and vulnerable countries during crisis. Second is to achieve universal primary education. Persons, particularly women who are educated and are more likely to seek medical care, especially during pregnancy, ensuring proper nutrition for their family, adopting healthy sanitary practices, and ensuring immunization of children. As an effect, infants and children have better survival rates, are healthier, and better nourished. If these are attained, children who receive primary education are more likely to marry and have their own families at a later stage in life, practice family planning, and have fewer children, know rights, responsibilities, and civic obligations, seek employment and sustain personal and family needs, have decreased risk of getting sexually transmitted infections like HIV and AIDS, and support and protection of developing and vulnerable countries during crisis. Third is to promote gender equality and empower women. Gender equality means equal representation of men and women. It implies that all genders should have equal value and treatment. Equal gender treatment empowers women and other groups, creating opportunities in education, work, finances, and other aspects, which improves the economy and lessen effects of financial crisis. Gender equality can be achieved through early childhood development intervention, promotion of women's political rights and involvement, improved reproductive health program and policies, education and integrating gender equality in school curriculum, improve women's access to work and strengthen labor policies for women, and support and protection of developing and vulnerable countries. Fourth is to reduce child mortality. Programs and policies which help reduce child mortality, like improving nutritional intake, healthcare facilities and infrastructure, and other fields which improve children's lives, strengthening local and national health programs and policies is one way to reduce child mortality. This includes immunization programs, assuring the survival and better health of mothers, improving reproductive health programs and policies, and better nutrition program for infants, children, and mothers. Fifth is to improve maternal health. Improve maternal health is not only about mother's health but also involves the health and wellness of the family. Maternal health also helps eradicate other problems like poverty, gender inequality, decreased workforce, lower birth deaths, and disability of women. Some ways to improve maternal health include improve and proper nutrition of mothers, teaching the benefits of birth spacing and small family size, educating young boys and girls about the importance of maternal health, and better and improved access to hospital care, especially obstetrics, gynecology, prenatal, and postnatal care. Sixth is to combat HIV, AIDS, malaria, and other diseases. Emerging and re-emerging diseases like HIV and AIDS, malaria, influenza, and other diseases affect productivity and growth of nations. Some of the effects of disease outbreak are loss of jobs, shortage in professional workers, and creating social crisis. Children are the most vulnerable and are exposed to exploitation and abuse, undermining their normal growth and development. Some ways to combat diseases include effective prevention, treatment, and care like improve housing conditions, increase access to anti-malarial medicines, promoting safer sex behavior and preventive education for all, promoting tuberculosis screening of HIV, AIDS persons, and tuberculosis directly observed treatment short course therapy, and promoting the use of insecticide-treated nets to fight mosquito-borne diseases. Next is to ensure environmental sustainability. Investing in supporting sustainable energy like solar, wind, and water energy helps support jobs, create business opportunities, and save remaining non-renewable energy sources. Environmental sustainability assures people to live healthier and enjoy a clean and green environment. Some of the benefits of a sustainable environment are cleaner air and environment, clean, environment-friendly, and renewable energy, new and aspiring jobs and business in energy, and increased access to sanitation. Last is to develop a global partnership for development. The United Nations, World Health Organization, World Bank, and governments work together to make sure there is a fair trade and that heavily indebted countries obtain relief and funds to combat poverty, malnutrition, and funds for education and social projects. Some benefits of global partnership are expanded international trade agreements, improved access to affordable medicine, reduced poverty through government debt relief grant, and develop information and communication technology infrastructure. The 8 Millennium Development Goals, which range from having extreme poverty rates to halting the spread of HIV and providing universal primary education, all by the target date of 2015, form a blueprint agreed to by all the world's countries and all the world's leading development institutions. They have galvanized unprecedented efforts to meet the needs of the world's poorest. The United Nations is also working with governments, civil society, and other partners to build on the momentum generated by the Millennium Development Goals and carry on with an ambitious post-2015 development agenda. And these are the 8 Millennium Development Goals. Thank you for listening and watching. Have a nice day.